The following is the Universal Precautions Blood-Borne Pathogens Training for Canyon School District. This training will help limit occupational exposure to blood and other potentially infectious materials, since any exposure could result in the transmission of blood-borne pathogens, which could lead to disease or even death. Blood-borne pathogens are microorganisms carried by human blood and other body fluids. Transmission of these diseases may be through blood, body fluids, breaks in the skin, broken glass or sharp metal contaminated with blood or body fluids, needles contaminated with blood or body fluids, as well as touching contaminated objects, then touching one's mouth, nose, or eyes. Hepatitis B virus, or HBV, is the most infectious blood-borne pathogen and can survive outside the body for up to a week. Vaccination for HBV is available and effective. If you become infected with HBV, you may have flu-like symptoms, pain on the right side of the abdomen, a condition where the skin and the whites of the eyes turn yellow in color, known as jaundice, dark urine, like cola or tea, and pale stools. The hepatitis B vaccine series must be offered at no cost to all staff who are at risk of an occupational exposure to blood or other potentially infectious materials. Staff considered at risk should be notified by the district. Vaccination is a series of 3 injections over 7 months with relatively few side effects. Hepatitis C virus, or HCV, has long-term effects which include chronic liver disease and death. No vaccine is currently available for HCV. The virus does not survive well outside of the body. Hepatitis C symptoms are very similar to hepatitis B symptoms: pain on the right side of abdomen, jaundice, fatigue, appetite loss, nausea, dark-colored urine, and pale stools. Human immunodeficiency virus, HIV, attacks the immune system and can cause AIDS. AIDS is the second leading cause of death for 25 to 44-year-olds, as well as AIDS is most commonly spread by unprotected sex or sharing needles. Symptoms of HIV include flu-like symptoms, night sweats or fever, weight loss, fatigue, and swollen glands. You may also develop AIDS-related illnesses, including neurological problems and cancer. A person with HIV may carry the virus without developing symptoms for 10 years or more. Who is at risk? If you come in contact with any blood or body fluids, you are at risk. The best way to prevent exposure is to use standard precautions. Have personal protective equipment such as gloves, goggles, and disposable aprons available at all times. Treat others as if they are infected. The primary cleanup of blood-borne pathogens should be done by trained custodial staff. The contaminated area should be secured until cleanup has been completed. For personal cleanup, wash exposed areas with soap and water for a minimum of 1 minute. Also, change out of contaminated clothing. To limit exposures, use standard precautions and practice good hand washing every day. Use personal protective equipment. Do not recap needles. Place broken glass and needles in a sharps container. Clean and decontaminate work surfaces and equipment using appropriate disinfectant that is available through custodial services. Do not eat, drink, apply cosmetics, lip balms, or insert contact lenses where exposures may occur. Personal protective equipment, or PPE, includes gloves, Band-Aids, gauze, mask and eye protection, CPR face shield, disposable apron, antiseptic wipes, absorbent materials and scoop, and red bags. For your protection, wear gloves and any other safety equipment when working with body substances. Avoid cleaning unknown liquids without gloves. When removing gloves, make certain to follow these 7 steps to protect your hands from touching the contaminated exterior surface. What do you do if you're exposed? Report it immediately to your supervisor. Don't wait. Work with your supervisor and Canyon School District's Risk Management Coordinator, filling out an incident report form. For a quick review, just remember, treat all body fluids as if infected and wear your personal protective equipment. As a reminder, bloodborne pathogens training should be completed 10 days from hire and annually within 2 weeks of the beginning of each school year.